Well, good morning, everyone, and welcome to the Maryland DC Credit Union Association's webinar on the Maryland's Family and Medical Leave Insurance. So we wanted to welcome the Department of Labor for being here and want to thank Regan Vaughn, the Director of Policy and Community, for the department, along with Stacy Jefferson, who is the Community and Stakeholder Engagement Lead for the Family and Medical Leave Insurance for the Maryland Department of Labor. Just again, want to thank them for taking the time to join us. When they have concluded, they're going to do a presentation. As always, in all of our webinars, this is recorded. It will be made available to all of the registrants after by tomorrow, and we will get that out to you. We're also joined by John Bredehoft from Kaufman Canoles. Many of you know John as one of our MVPs who has been on dozens of these town halls with us as well. So I don't want to stand in the way. I will just hand it over to Regan and Stacy to get us started. So welcome and thank you very much for your time today. And if I can
Thank you,
mention,
John.
sorry, one other thing, if anyone has questions, as always, please put them in the Q&A and we will either get to them at the very end or if there's an opportunity right during the presentation. So thanks, and sorry, Stacy, take it away.
It's okay. Um, Thanks, John. Thanks for the introduction. Good morning, everyone. As stated, I'm Stacy Jefferson, the Community and Stakeholder Engagement Lead for the Maryland Department of Labor's Family and Medical Leave Insurance Division. And I'm joined by my colleague, Ms. Regan Vaughn, who is our Director of Policy for Family and Medical Leave Insurance Division. We're really excited to be here with you today to talk with you about the Maryland's Family and Medical Leave Insurance Program. Um, and as stated, we do have a formal presentation for you all today. And we do ask that you give us time to get through the presentation, and then we will open it up for a question and answer after. And we will make sure that we leave ample time for that. And so our presentation today, we will give an overview of what is family. Um, we will talk in depth about how family will work. And then also what you can do now as an employer to prepare for the launch of Maryland's paid family and medical leave insurance system. And so let's jump right in. So what is family? For those of you who may not know, in 2022, the Maryland General Assembly passed the Time to Care Act, which established paid family and medical leave insurance in Maryland. And what it is that it ensures that workers have paid family and medical leave to take time away from work, to receive job protection, and to earn up to $1,000 a week for up to 12 weeks or continuously or on an intermittent basis. And so Maryland is not alone. And as you can see in the map that we have here, in yellow, those are existing paid family leave programs. And in red, they are paid family leave programs that are forthcoming, that are in implementation. And so there are several nearby jurisdictions that provide paid leave, including Washington, D.C., Delaware, and New Jersey. And this really helps us. In Maryland, we have been in close communication with our neighboring jurisdictions and others to really learn about their programs and learn best practices from those states. And this will help us to ensure that we have the best program for Maryland's employers and workers. And one of the things that we've been learning from other states is some of the benefits for employers. And we just want to go over a few of those today. And so employers will benefit from reduced turnover and boosted morale. There's greater cost predictability while an employee is away, compared with the unpredictable cost of having to pay an employee's wages while they are out. There's also higher workforce attachment. Paid leave has been shown in other states to bring women into the workforce and to keep them long term. And this is especially important for Maryland because um, the comptroller's recent State of the Economy report revealed that women have returned to the labor force at lower rates since the pandemic, particularly the 25 to 34 old age range. And then it also levels the playing field so small businesses can compete for top talent with this valuable and affordable employee benefit. As we know, it's historically been offered far more often by larger employers. And so next, I want to turn it over to my colleague, Regan, who will discuss how FAMLI will work in our state.
Thanks, Stacy. So first, we'll go over some key dates. We are currently working on getting the regulations for the program published and then finalized. We recently, I guess it was late last month, published on our website some draft regulations that we want to put out for comment. We've been hosting informal sessions with stakeholder groups. Anyone signed up on our listserv is invited to let us know where our thinking is right and where our thinking is wrong on the regulations. So if you are interested in weighing in on the regulations or seeing more in detail what we're thinking, they are published. It's paidleave.maryland.gov is our website, and we can drop a link to the regulations in the chat. But we do expect those to be finalized by the end of the year. So that framework is available and you know exactly what's coming. We then expect contributions into the fund. Since this is a paid leave program, we need funds to pay out. So it is done through a contribution basis. And those in statute are currently set to begin October 1st of this year. But there's a bill pending in the General Assembly. We had our hearing yesterday, another hearing tomorrow, that proposes shifting the date 3 calendar quarters to July 1 of 2025. And that gives us the time to get the IT systems up and running to be able to accept those contributions, and also gives employers more time to plan and get ready. Because we need to seed the fund in order to stay solvent and issue benefits, it requires that we also push the benefit start date back. And so the legislation that's currently pending would move that date back 2 calendar quarters to July 1, 2026. And Stacy, can you advance? There we go. So FAMLI takes a lot of our guiding principles and structure from FMLA. And as we've done these presentations, we've realized that most of our audience is familiar with FMLA. So we're going to use that as a touchstone to talk through where there's similarities and where you're going to see differences between the two programs. The first similarity is FAMLI uses the exact same language as FMLA in terms of health benefit continuation. If you have an employee out on leave who is taking FAMLI, then the employer is required to continue their health benefits the same way they are provided when the employee is at work. Just like FMLA, FAMLI can be taken on a consecutive or intermittent basis. And also, just like FMLA, the qualifying events for FAMLI are the same. And I'll go through those events in a few minutes. Where we start to see a little deviation between FAMLI and FMLA is job protection. For the most part, FAMLI has the same job protections as FMLA. If an employee is taking FAMLI, they do need to come back to a same or equivalent position when the leave is over. There is a limited hardship exemption, however, under the family law. So there's a little bit of deviation there, but not much. And then FMLA is capped at 12 weeks a year. Family also has a 12-week annual limit, but there is one exception to that limit. And that's if an employee has both their own serious health condition and welcomes a child into their home in the same year, that 12-week annual limit becomes a 24-week annual limit. They can use 12 weeks for each instance. And where we expect to see this the most is if a birthing parent is placed on bed rest. And so they would use their serious health condition leave for the bed rest, but then still have their bonding leave available. But it's not limited to that circumstance. There are some key differences, though, between FMLA and family. First, I always have to point out FMLA is a federal law. As much as I would love to be able to tweak it or recommend changes so it sits better with family, we can't do that. We don't have the power to do that. The Maryland Department of Labor can only work with the family law and try to make it as comparable and run concurrently with FMLA as possible. FMLA, as you probably know, is unpaid and therefore unfunded. There's no contributions going into it because it only guarantees time off. It doesn't guarantee that wage replacement. Whereas family does have wage replacement. And because of that is a funded program. We are collecting contributions into the program. Another key difference is FMLA is very position-based. It depends on the size of your employer. It depends on how long you've been with that employer. And so it's the relationship between the employee and the employer that determines whether or not an employee is eligible. Family is very different because it's employee-based. It really doesn't matter who the employer is or how long an employee has been with that employer. It only looks at whether the employee has been employed in Maryland for the eligibility period. And so that is going to be a real big difference that we're going to see and work with going forward. FMLA has a very limited definition of family member. It primarily focuses on people living in the employee's household. In order for them to be able to take leave, family has a much more expanded definition of what it is to be a family member and who you can take leave for. And the person does not have to live in your household. So it can be your adult child. It can be your parent. It can be your parent-in-law. Siblings are also included. So there will be more reasons why people can take family than they would be eligible for FMLA. And then within FMLA, it's the employer processing the request and handling the paperwork and approving the leave. With family, the state is going to be processing the claim. The state will be receiving the medical certification and the application and determining whether or not it meets the criteria for family. Again, there's an exception to there if an employer opts out of the state plan and uses a private plan, and we'll talk about that a little bit more in detail in a minute. So some of our most common questions, what employers will participate? And the law is pretty clear that everyone is covered. There are no exemptions in terms of an employer within the statute who doesn't need to both pay into the program and offer this to their Maryland-based employees. Unemployment has a lot of exemptions. I think workers' comp has some exemptions. FMLA, of course, has exemptions. There were absolutely no exemptions in the family statute. In terms of contributions, though, there is some deviation between employer types. So an employer with 15 or more employees can be expected to pay in the first year 0.45% of wages or their payroll up to the Social Security limit for each employee. If an employer has 14 or fewer employees, they are not required to make the employer contribution. If someone is self-employed and has no employees and just wants to participate on their own, that participation is optional, and they would pay 0.9% of wages. And then employees, no matter who they work for, the size of the employer, are required to contribute 0.45% of wages up to the Social Security cap. So for most people, 0.9% of wages will be contributed on their behalf, half coming from the employee, half coming from the employer. It's only those employers with 14 or fewer employees where the state will be receiving 0.45% of wages, because only the employee side is due. We have gotten a lot of questions regarding whether or not an employer can just cover an employee's contributions and have that as a benefit they offer. That is absolutely fine. The only restriction is that an employee can't pay more than the 0.45%. There we go. So we talked about what employers are covered. Now we're going to talk a little bit about which employees are covered. And there's two different types of covered employees. The first is who's required to make contributions, who are contributing employees. And anyone working in a Maryland-based position is required to have contributions submitted on their behalf. We are using the same rules as unemployment insurance. So if someone is localized in Maryland for the purposes of unemployment insurance, then they are considered a contributing employee for purposes of FAMLI. We are trying to find synergies with our sister divisions. In terms of who is eligible to receive benefits, they have to have worked at least 680 hours. That's about 17 weeks in a position based in Maryland. So again, localized in Maryland under the UI rules in the 12 months before they need to take leave. So you start contributing the minute you're hired. You're not eligible to take leave until you have those 680 hours. And it is completely based on where you're working, not where you live. And it is a portable benefit. It is not 680 hours with that employer. So if you have two jobs, you could hit the 680 hours much faster. And if you change jobs, your hours worked are portable and come with you. So you don't have to be at the employer for 17 weeks before you're eligible for leave. The life events covered by FAMLI, again, these mirror FMLA. The first is welcoming a child into your home. That includes birth, adoption, foster care, and kinship care. An employee's own serious health condition would be a triggering event in order to take family leave. Caring for a family member with their own serious health condition, again, is a qualifying event. And then if you are preparing for a family member's deployment and dealing with exigent circumstances, that also is a life event covered by FAMLI. Where I think we're going to see the most administrative, trying to make this work and fit the puzzle pieces together, is how FAMLI interacts with employer time off. And initially, there's a pretty bright line rule. Employers cannot require workers to use their employer provided time off either before they access FAMLI or while they're using FAMLI. So an employer cannot have a rule saying you have to exhaust your sick days before you receive it, or you have to use your sick days concurrently with FAMLI. That is specifically disallowed under the statute. However, there is a caveat that an employer and a worker can agree to use employer-provided time off to top off the family benefit. So if the worker and employer can reach an agreement, let's say they hit the cap and they're getting $1,000 a week in a benefit, they can use that time off they've accrued with the employer in increments to help bring their salary to 100% so that they have 100% wage replacement while they're out. But again, that's only upon the mutual agreement of the employer and the worker to do so. The exception to this rule is if an employer has what we're calling alternative family purpose leave, which is a bank of leave specifically designed to cover a family qualifying event. So many employers, especially in the past decade, have added on a parental leave benefit. And they pay maybe 6 weeks, 100% wage replacement, 12 weeks. I heard one place was giving 6 months, 100% paid leave. If you already have a program designed to fulfill just one of the purposes, one of the qualifying events, or 2 of the 4, however it may be, we are calling that alternative family purpose leave. And an employer is allowed to require that to run concurrently with family. And that can be done a couple of different ways. Either the employee decides the employer benefit is just better than family and declines to apply for family, but does use the AFPL, that would reduce their ability to take a full 12 weeks of family that year. They could take family and have that be the primary benefit and then use AFPL to top off to get the 100% wage replacement, or any other arrangement they can work out with the employer, 6 weeks of AFPL and 6 weeks of family, however it may be. But that is the one time the 2 can be required to run concurrently. Now, there are going to be a number of notification requirements. I think every good labor bill has notification requirements. And this is when the employer is going to be required to keep an employee informed about the availability of family. The department is developing templates for these notifications that will be available to employers. But the 4 times that it is triggered in the statute is the employer needs to provide notice at the time of hire, annually, when just an annual notice. If an employee requests paid leave, and then when the employer knows that leave may be for a covered reason. So if you have a baby shower for an employee, you are required to notify them that family exists. If you are showing that they may need it for a covered reason, you're required to notify them. These notifications are going to play a key role if later on, when we give the employer an opportunity to raise any red flags about a claim that may come in, if you haven't provided notice, we are going to take that into account in our determination of whether or not to proceed with the claim. So in addition to being required to provide it, we are going to have you show us that it was actually provided if you do decide down the line to challenge a claim. So I think it's really important to point out what these requirements are ahead of time. So what happens when a worker files a claim? How is this going to work? We are currently developing the portal. It is going to be a new portal. that workers can access. And the worker will file a claim with the department that will include an application that has pertinent information and certification of the qualifying event. If it is time to care for a family member, they're also going to have to provide certification that the family member does qualify under the definition of family member. Once we receive that claim, we will immediately alert the employer that we have received an application from one of their employees. Employers are going to have accounts with us, and you are going to have to let us know what email address should be receiving these alerts. It's going to be really important to keep that address up to date. So we will send an alert to the employer. The employer has 5 days to respond, 5 business days, and let us know if the employee already took FMLA or AFPL that year and declined to apply for FAMLI. If it's fraud, if the application says they were in a car accident and they can't come to work for 6 months, but the employee's sitting in front of you absolutely fine and someone's fraudulently applying on their behalf, you can let us know about that. Or any other reason to deny the claim that's valid under the statute. Hardship is not a valid reason. It's our busy season. I can't lose this person. Those are not reasons why we would deny a claim. But if it has to do with having already exhausted the leave or fraud, we will include that in our determination when we're looking at the claim. As soon as the employer responds or if 5 days have passed, the department will begin processing the claim. We will consider it a completed application, and we have 10 days to issue a determination. Anytime there is a change in status to the application, so when we make a decision, if the decision is appealed, if there is a change to the decision or a request to change the decision, again, the employer will be notified. We're statutorily required to do that. But the worker will receive a response letting them know whether or not the claim's been approved within 10 days. And then within 5 days of that, the worker will receive their first benefit check or benefit transfer. They'll receive those wages if the leave has started. I should say you can apply either 60 days before the leave begins or 60 days after the leave begins. The employee does have that time span to apply. So if the leave has started, the funds will be transferred. If the leave hasn't started yet, then the funds will be transferred once the leave starts. And then the fund transfer happens on a biweekly basis. So when employers register with us early next year in our employer side of the portal, they will be automatically enrolled in the state plan. And that's a seamless way to comply with FAMLI. If you are in the state plan, the state will collect contributions from you. It'll be done through payroll withholding and remitted to the state on a quarterly basis. The state will answer questions from your employees, will be the ones processing applications, and then the ones issuing benefits. It really is intended to be kind of a one-stop because we'll have those quarterly contributions and wage and hour reports that substantiate the contributions. We'll know whether or not someone has 680 hours. And other than the 5-day notice period where we let you respond, the state will have the necessary information to do a benefit determination and an eligibility determination. If, however, you choose not to participate in the state plan, which is an employer's option, you can request approval of your own commercial plan or a self-insured plan. The commercial plans need to be approved by the Maryland Insurance Administration. Any insurance sold in Maryland needs to be approved by the MIA, and they will begin evaluating probably the end of this year those commercial plans. There are a number of commercial insurers that are interested in this market, are interested in coming into Maryland, and will be offering plans that are equivalent to or better than the state plan. And those will be available to purchase the way you might purchase a short-term disability plan. Another option is to self-insure your own plan, to make family part of your existing leave policies and benefit policies, and then to demonstrate to the department, likely through a surety bond, that you are financially solvent and able to fulfill the requirements. The statute is clear that an employee in a private plan has to be treated the same as an employee in the state plan. The benefits that are offered and the protections that are offered have to be the same as or better than the state plan. So the commercial plan, depending on your organization, may be priced differently than the state plan. And or there are going to be a lot, I think, of products available where either your family, your short-term disability, your long-term disability, maybe your liability coverage are all grouped together. And also there are a number of third-party administrators who are looking at family and trying to figure out how to help with leave management and incorporate it into their services. So there are options to go the private plan route, but there will be reporting requirements. And again, they have to offer benefits that are the same or better than the state plan. And I am gonna turn it back over to Stacy to wrap us up on this part, and then we'll take some Q&A.
Thanks, Regan. So, as Regan stated, we are continuing to build out the system. And so you're probably wondering what are some things that you can do now to prepare. And so just a couple things is you can sign up to receive our emails by going to paidleave.maryland.gov. We send out our lots of information. Again, even on our website, we've recently posted our FAQs to answer many of the questions that our stakeholders have had. In addition to that, we also have a draft of our regulations posted as well. We will continue to send out information. So please, to get the most up-to-date information, sign up to receive our emails. Also, you can begin by including family contributions in future budget planning. I know many of you are looking at your future budgets, and so now is a good time to start to think about family and how that will fit in. Also, start thinking about how your existing benefits may interact with family. Many employers we know already offer benefits, and so starting to think about how that benefit package that you already offer will interact with the family program. And then also after registration, all employers will automatically be enrolled in the state plan, as Regan mentioned. So you can start to think about what's best for you as an employer, whether it's private plan or to be in the state plan. And so now is a good time, while there aren't private plan options available, to start to think about whether or not private plans is best. And then again, just to stay up to date with us, visit our website. Also, you can reach out to us at paid.leave@maryland.gov with any questions or anything that you may have, or our team. Also, we continue to be out doing presentations to educate employers in Maryland on FAMLI. And so if there's other organizations or networks that you have that you think that we should be out and talking to, please feel free to reach out to us also to schedule presentations. And with that, I'm going to open it up for questions that you may have for us.
Stacy, Regan, thank you very much. That was great. So there's a few questions out here. I'll just kind of go through them. One of the questions was, does this offset disability benefits for companies?
So we expect the disability market to change a little bit in Maryland in terms of what's a short-term disability policy, but FAMLI would be the primary benefit. And then if an employer wanted to offer a short-term disability benefit that wrapped around it, especially since our benefit is capped at $1,000 a week, there may be employers who want to have a higher wage replacement for their employees, so they could have a short-term disability policy on top of that. Or they could keep their current short-term disability policy and let an employee choose between using their short-term disability, because maybe it's a better benefit or a higher benefit level, and that would reduce their ability to apply for FAMLI later in the year. So there's going to be a couple different ways they work together. We hope employers don't do this, but they could also drop their short-term disability policies and rely on FAMLI. There's going to be a couple different options available to people.
Right. And I know for some institutions, they've got PTO, pay time off, that they can accrue versus sick pay. This doesn't affect that at all, right? Correct? That's a separate issue. So people could still take their PTO that they've accrued over the time for full pay versus
Correct.
this.
If someone would prefer 100% and, you know, has worked at a job for a really long time and has more PTO than they know what to do with, they could choose to do that. But we would want to make sure they were notified of their FAMLI option. So it was a conscious decision to take that time off. In terms of sick time, we kind of think of that as that's for the common colds. FAMLI is for when someone has cancer. You know, they're similar in terms of leave, but generally FAMLI is for that more serious health condition.
So the next question that comes up, and I believe you've addressed this in that, you know, this is coming, but, you know, when they submit their application, is there going to be a secure form, a portal for that to be done? And I believe you addressed that. I just wanted to just reinforce that.
Yeah, we expect 99.9% of things to be done electronically. We are going to be digitally native. Most programs, you know, start on paper and move to digital. We are digitally native. And the civic tech industry group has really taken an interest in FAMLI and being able to start digital platforms for a benefit program across the country, not just in Maryland. So we have an RFP that just closed, is being evaluated to create our digital IT platforms to work with us to get this right and to deliver IT. And hopefully it's a different way than you've seen traditionally done by both state and federal government.
Great. So the next question is, and this would probably apply to, I know some of the folks in our call, we have credits up in Delaware that have employees that live in Maryland or DC or Pennsylvania or Virginia, but they work in Maryland. How does that affect an employer? What is their requirement?
It is based on where you work, very similar to unemployment insurance. So residency for employees doesn't come into our consideration at all. If someone is remote 5 days a week from Maryland, they are considered to be localized in Maryland. Delaware is also standing up their program. We, from a first look, it looks like we are using similar localization rules, but we know that we are going to have to enter into memorandums of understanding with both DC and Delaware to make sure that employees aren't being double counted and we aren't losing employees somewhere in the process. But it really is going to be based on those unemployment insurance rules, which I think the memo is called the UPTA. It goes back,
Right.
I think, 50 years. I mean, it's well settled law. So we really want to rely on that as we're trying to figure this all out. And our assistant secretary came from the DC program. So is intricately understands how their program works. So we can try to be as seamless as possible for those employers that are crossing jurisdictional lines.
Right. So yeah, so that's what I had thought. So if they work in Maryland, regardless of where they live, they receive the benefit. Correct.
Yeah.
Okay. The next question or that comes up says the word contribution has a double meaning, either a gift or requirement that should be clearly stated. In the case the contribution, it's not a gift, but it's actually a requirement.
It is a requirement.
That's
It's
what I
actually this unemployment calls there's contributions in the statute too. It's left over from something, but it is a required wage withholding or payment to the state. Yeah.
So this next question is similar kind of to two questions ago about it's about where people work. So if they're working in Maryland. So the question is if an employer has 15 or more employees, what if they say have 20 employees, but only 14 work in Maryland and the other 6 are out of state? Would they still have to comply because their total employment is 15 or more? Or is it just because since they have 14 in Maryland that they wouldn't have to comply?
Yeah, so first, I just want to be clear that the 15 threshold is only for contributions. Employees are covered no matter the size of the organization. The General Assembly wrote in an exemption for employers with fewer than 15 employees in terms of making the employer side contribution. And that was to give Maryland's small businesses a break. So with that intention, we are considering your nationwide workforce when we are doing the 15. The language was not intended to give a large corporation who only happens to have 3 Maryland employees a break from the contributions.
Right.
It really was intended for those Maryland small businesses to help with the financial impact of the law.
Okay. That makes sense. So, and just for my own sake, to be clear, so if you're 14 or under employee, you still have to provide the leave along with $1,000 per week to your employees, but you
The
would
state
self-fund that.
does if you self-fund, yes, you would
Right.
have to do that. If you're in the state plan, we would do the $1,000 a week.
Okay.
And we're going to take a rolling average, or I'm sorry, we'll make a yearly determination if you hit that fewer than 15 threshold or not. We'll get quarterly wage reports from every employer and look at how many people were on payroll, average the 4 quarters. If it is a number that is fewer than 15, then as long as they can show they don't have any employees outside of Maryland, they'll get the exemption. If that average is more than 15, then they're not eligible for the exemption.
Okay. Let's see. The next question. The next question is around, the impetus for the bill. But I think you addressed that early on that you don't deal with the legislation, you deal with the actual, implementing the legislation. So that would be to talk to the legislators, not the department. So
Okay.
we'll move on to the next question. It asks about how will employee-based eligibility be tracked, and how will be tracked for private coverage with one or both employers involved. Yeah, so that one, I believe you just talked about that you're going to be tracking it by getting the quarterly payroll reports.
Correct. And those will be required of private plans as well.
Okay. So that's how you would track it. If somebody is private, you're still going to have to get that information.
Correct.
The next question talks about, am I correct? Based in Maryland, offices in Maryland only. Does it apply to DC with credit union with no a DC credit union with no offices in Maryland? Yeah. So unless the employees are working inside Maryland, not where they reside, but where they work, a credit union would not be subject to this as long as they don't have operations in the state of Maryland.
Correct. Or remote workers. With
Okay.
remote work, if someone's working remotely in Maryland, in some sort of position, that could bring them into the program. But the work has to be done in Maryland.
So this another question about the under 15 employees, as far as how it works. And I know you touched on that, but I'm sure it still is a little bit confusing where the contribution isn't required for under 15, but the benefit is required, correct?
Correct.
So
Um,
could you just touch on that one more time for folks?
yeah, sure. So I think the best way to think about it is no employers are exempt from providing the benefit. If you have a nanny in your household in Maryland, you are an employer who is covered under this statute. There is no minimum threshold. Um, if you have an employer-employee relationship, the benefit has to be provided to the employee. And the policy behind that is, cancer doesn't say, oh, you only work, you have no colleagues, you're the only
Right.
employee. I'm not going to strike in your family, or I'm not going to strike you. Any employee can get sick. So there's no threshold there.
Okay.
The General Assembly realized there was a financial impact of this and decided to help ease that for the smallest employers by waiving the contribution for fewer than 15.
Okay. The next question is around the private insurance. So will you post at somewhere those plans that are approved by the state? And I believe you mentioned that that would be, but that's down the road as those seek
Yeah,
approval from the Department of Insurance.
yeah, I have learned enough about insurance to be dangerous. We are working closely with the Maryland Insurance Administration. The plan is that they will develop what they call their policy bulletin, and it will include all the requirements for family, and it will have all the requirements for a typical life and health policy required under Maryland law. And insurance companies respond to the policy bulletin with the product they intend to market in Maryland. It takes about 6 months of back and forth with the MIA. They're going to make sure it checks all the family boxes. They're going to make sure it's actuarially sound, and they're going to make sure the proper contract requirements are in there. Once that happens, they will approve the products as both insurance products that can be sold as in Maryland, and also what we're loosely calling family certified. In Colorado, which is the most recent state to come online, about 24 insurance companies submitted products to their insurance commissioner. Once those products are approved, we will have a list on our website of all of them. And then when an employer applies to offer a private plan, they will have to list the product they will be providing. They have a contract with an insurance company to provide. We are trying to get all the timing to line up, which is a feat in itself. Other states have had a temporary period where they call a declaration of intent, where if the products aren't ready before contributions start, employers can let us know they intend to purchase a private plan and offer a private plan to their employees. And then we, and this is still being worked out, could potentially waive those early contributions. But if the employer doesn't come through with the private plan, they would owe us all the back contributions.
Okay.
So it's kind of a risk.
Right.
But we're really trying to get the timing to line up. It just, to use an overused metaphor, we're building the plane as we're flying it. So
Right. So again, I believe this was you addressed this, but I just want to make sure since it was asked, was this does not replace sick and safe leave.
no.
That's a separate issue. This is strictly family leave.
Yes.
And then another someone asked, and again, I believe you mentioned this, but if an employer already offers short-term disability and or paid leave that would compensate for the time off, is there an expectation that you are also have to pay the 0.45% contribution rate if an employer does that? So it sounds as if you're going to provide that, they would have to apply for a self-funded plan versus paying that if it's a larger corporation.
Yeah, so the self-funded plan would have to include all the qualifying reasons. There, I don't know that I've ever seen an employer that currently has a plan that is equivalent or better. There are some that come really close. But if they did that, then they would show us that their policy is equivalent or better than family. Um, and it is going to be an apples to apples evaluation. 100% for 6 weeks doesn't check the box
Right.
of 12 weeks of partial. But if they can show us that policy meets the requirements or has been adjusted to meet the requirements, then we could approve that as self-insured and then would likely require a surety bond. We're still trying to figure out exactly how that works, to show that if a number of people went out at the same time or went out right before the business closed, there would be funding to cover that leave.
The next two, I believe we've answered. Just want to make sure. We talked about if somebody is living outside of Maryland, but their payroll code is Maryland, that they would still, it would still qualify, that they would still have to pay as and contribute because that person works in Maryland, because that's where their code is, right?
Yeah. If they are working in Maryland, they pay in. Yeah.
So the next question is interesting. I didn't think about this. So if somebody is they're working in Maryland, but maybe 5 days a month they're out of state working, that does that matter?
That shouldn't matter. The localization rules talk about temporary duty stations and how to take that into account. If it really looks at where your nexus and you're based. And my boss is an unemployment nerd, so I depend on him for a lot of this. He has studied it. But if people are doing their unemployment insurance taxes properly, this should flow
Okay.
with the unemployment insurance taxes. But we also realize not everyone is doing those properly, just because of how complicated they are. But it should flow with where you are contributing to that person for
Okay.
unemployment insurance.
So we're almost done with the questions. This is one, so it seems this would be during the transition. Once it goes into effect, would employees who are already on qualified leave be eligible to submit claims? And then would that restart the 12 weeks at that point? So I believe it's right. So since it's moving to July 2026, if somebody went on leave in June of 26, would they then apply at that point and the 12 weeks start, or does the 12 weeks still start from when they had gone?
We are going to have a crunch. I mean, I don't know what else to call it. July 1 of 2026, where someone maybe who already took parental leave in January of that year would suddenly be eligible to take it again under
Okay.
family. That's just the way the statute works. July 1, they suddenly become eligible for benefits, and it doesn't matter what happened before July 1 of 2026. And our actuary actually believes there will be more claims that first year than the second year. because of people either waiting or postponing surgeries until July 1, 2026, or extra eligibility because of events that happened
Right.
at the end of state fiscal year 25.
Thanks. So, in the last couple of questions, I'll just repeat, as we mentioned, it's all based upon where do people work. So if you're an employer in the district, but they're working in Maryland and you have a global workforce of over 15 or more, then it does apply. And then the last question was about the private plans. And when can it be expected for those to be approved? You addressed that's really up to the Department of Insurance. It's not, and they're working to get that to coincide the time frame. But we can just let you know from the association, we'll be monitoring this as well and communicating updates as we get them from the Department of Labor or the Department of Insurance as part of our communications that we do back to the membership as well. So
good. And we have a form on our website to submit questions if they're not answered in our FAQs, and we evaluate those questions on a regular basis to try to add into our FAQs. So if the association wants to send questions or individuals want to send questions, we're really trying to publicly answer as many as we can to get that information out there.
So one quick question, last question just popped up. 12 weeks leave within 12 months. So is it the July 1st through July 1st, or is it
rolling?
rolling?
The year starts the day the first leave starts.
So if I take leave in May, then my 12 weeks counts between May to May, right? Yeah. It's a rolling. It's not based upon when the program begins. It's based on when the person first takes their leave.
Correct.
Okay. Great. Well, thanks for doing all that and putting up with all my questions and all the inquiries, Stacy, Regan. It's been very helpful. So I don't know if you have any last things you'd like to mention, and then we'll transition to John.
Just thank you for the opportunity. These questions are extraordinarily helpful as we refine our thinking and to give us a pulse on what concerns are out there. And where we can address these concerns, we really do try to.
Great. And just a big thank you again I know we talked about different dates, different times, and just your flexibility has been greatly appreciated, and along with your time.
Thanks for having us. And we'll also share the slides with you all as well, so you'll be able to send them.
Great. Yeah. So just to repeat for everybody that's on that didn't hear me earlier, as with most of our webinars that we do, we will be providing the slides and the recording, access to the recording, no later than probably end of day tomorrow, but probably much sooner knowing Crystal. She'll get that done quickly. So thank you. So we're going to transition now to John Bredehoft from Kaufman Canoles. So John, I will hand it off to you and let you take off. You're kind of a man that needs no introduction, so take it away.
Thanks, John. And before I say anything, let me first say kudos to Ms. Jefferson, Ms. Vaughn, and to the Maryland Department of Labor. There are on their website very extensive proposed regulations that give a very good reading about what they anticipate doing when they implement the law. There are FAQs, which are excellent and detailed for employers and for employees and for stakeholders. And of course, this type of outreach session is invaluable. I've been doing employment law for about 30 years, and this is probably more detail about a new state employment requirement in advance of it being applicable than I've ever seen. So kudos. I mean, this sort of session and the material you have online is invaluable. Let me also note that I prepared an outline of 20 things I was going to say about the statute, and Ms. Vaughn addressed about 19 of them in the questions and answers. But there are a couple of things that I do want to emphasize. Some of it might just be for emphasis. Some of it might be put a little twist on it. There were 4 or 5 issues that I think, and I won't take the full hour, 4 or 5 issues that I think bear thinking about. The first one, and this is what most of the questions were during the first session, is what about interjurisdictional employers? And there's both a traditional and a non-traditional side to this. The traditional side, let's say you're a DC based or even a Virginia based or perhaps a Delaware based credit union, and you have most of your branches in a different state, but you have one branch in Maryland. Well, the folks at the branch in Maryland are under this program, no matter where they live. And none of your other employees are under this program, and no matter where they live. That's easy, okay? The hard part, I think, so DC, credit union, 3 employees in Maryland, those 3 are covered, rest of your employees aren't. The more interesting, and I think, administratively difficult question is non-traditional, remote working. I have some credit union clients who actually have people working full-time remotely from a state far away. One of my clients is a CFO in Florida. If you have someone remotely working full-time from their house in Maryland, obviously they are going to be covered. If you have someone who works half the time in DC and then remotely half the time in Maryland, probably they are going to be covered because they will probably, if they're working half-time, work 680 hours in the preceding year, which is the cutoff for coverage. The administrative problem comes with your having to track for your required reporting to the state where a non-traditional employee is when they're working. You'll be required to report, for example, that your director of lending, who has an office in Alexandria, has also worked 700 hours in Maryland. And since the director of lending is in all probability an exempt, non-hourly salaried position, that means the people who do a lot of remote work in Maryland are going to have to keep track of their hours, even though they're not hourly employees, because that's going to be needed for reporting to the state to determine whether they are eligible and required to participate in the program. So that's one thing I think you need to think about. The other thing that HR people are going to need to think about is what about new employees who come online, even in Maryland, from a Maryland institution with Maryland offices, new employees who come online. Now, the state will have kept track of how many hours they billed at their previous employer, but you won't know that necessarily. So how do you keep track of when they hit that magic 680 hours worked in the preceding 12 months? I think you got to make a record or ask them of how many hours they've worked in the preceding 12 months for their other Maryland employer, because, of course, your records aren't going to determine whether they're qualified or not, but they're going to be very important when you try to figure out what's going on. For example, a new employee comes to you from another institution in Maryland. You're in Maryland. They're working as a loan service representative, or they're working on the front line, and they've been working for you for about 2 months, and all of a sudden they want to go on family leave, paid FAMLI is the abbreviation, family leave, and you have no idea whether they meet the 680-hour threshold. So I think you need to put in some type of onboarding requirement that'll at least get you some of that information, or have the ability to go back to the employee when they put in that requirement or tell you that they're going to be out for 6 weeks or 12 weeks. Oh, okay. We see now that you worked 500 hours for another Maryland institution. And of course, the fact that the years are rolling makes it even more difficult to do that. I'm not quite sure how to do that, but it doesn't seem to be an insurmountable problem. Okay. The other thing about interjurisdictional employers is you may have part-time employees, and they will never be eligible for these benefits because they're not going to work 680 hours in Maryland. Maybe they work 300 hours in Maryland, 300 hours in Virginia. Or they only work 300 hours a year. You still have to collect and forward information to the state. Okay? You have to forward information on all Maryland-based employees, even if they're not eligible, even if they'll never become eligible. Okay. What else? The one thing we keep thinking about, and this is probably a failing of employment lawyers. When we check on some other state, we say, do they have a little FMLA? And it's tempting to call this Maryland's little FMLA, but it's not. The eligibility requirements are different, as you know, or you may know. If you have a life, you may not know, but I know that under the federal FMLA, an employee has to be working 1,250 hours in the preceding 12 months to have eligibility. This is different. Under the FMLA, you have to have 50 employees within 75 miles. But here, as long as you have 15 in the United States, that's going to be good enough. Unsure whether Guam counts and if that's compliance in Guam. But, it's not just a state level FMLA. It's different in terms of eligibility and different in terms of coverage. And that's sort of the second issue I wanted to talk about, how the eligibility requirement may differ or not across the three statutes, the federal FMLA, this law, and the safe and sick leave law. The existing Maryland safe and sick leave law says the leave can be taken if the employee is caring for or treating the employee's own mental or physical illness, injury, or condition, or to obtain preventive medical care for the employee's family, or to care for a family member, yada, yada, yada. The word missing from the existing safe and sick leave statute is serious. Okay? The condition doesn't have to be serious to entitle someone to safe and sick leave. On the other hand, there's nothing that says, and of course there shouldn't be anything that says, that you can't take the existing safe and sick leave for a serious condition, which means that you can take safe and sick leave. And in fact, the draft regulations contemplate a situation where an employee is taking safe and sick leave, and then after a while, they go on to this family leave, okay? There's nothing that says the same condition couldn't qualify you for both, because it doesn't have to be serious, but it can be serious under safe and sick leave. So you could have someone taking all of their accrued safe and sick leave, which isn't very much actually, and then starting on to the 12-week family leave. Okay, that's a situation where they overlap. Now, the definition in the family proposed regulations, and I'm going to be referring to the proposed regulations a bit. They are proposed, they are not final, they are not binding, they're a work in progress, but they do give us, a way to look at the law and how it'll be implemented. Under the regulations, proposed regulations, a serious health condition is a condition, it's an injury, impairment, it's a condition that either requires inpatient care, okay, you're in the hospital, it's a serious condition, or requires continuing treatment by a licensed healthcare provider, including home health care, or involves the donation of a body part. Okay, let's leave that one on the side. You're giving somebody a kidney, okay, that's fine, you qualify. But inpatient care or continuing care, those are the two requirements under the new Maryland law. And what's continuing care? There is a proposed regulation, and God bless whoever put this together, that is in one point type and takes an entire page. And it explains what continuing condition means in order to be a serious health condition, what continuing treatment means. But then at the end, it says, but for chronic conditions and for pregnancy or prenatal care, continuing care doesn't have to mean continuing care. It doesn't mean continuing treatment. So if something chronic like COPD or asthma, that can be a serious health condition even without continuing care. Now, that would qualify for leave under the new Maryland statute. It most likely would not qualify under the federal FMLA. The FMLA defines a serious health condition as, again, a condition that involves either inpatient care or continuing treatment. And you can get medical certification for it. So there are situations, I think, where safe and sick leave and family and FMLA will apply. I think there are a lot of situations where FMLA and family will apply. And there are a number of situations which could include standard prenatal care where only the new Maryland law would apply because it's not a continuing course of treatment. If you go in for one prenatal visit, that doesn't qualify you for federal FMLA. So we need to be careful about just adopting the FMLA thinking process into this. I should also note this, that the new Maryland statute gives you 12 weeks of leave, and this was mentioned, but you can get 24 weeks of leave if you have your own serious health condition, and then you adopt, give birth, have a bonding period with a new baby. So it could well be, and in cases of serious prenatal complications or postnatal complications or postpartum depression, it could well be that the leave extends not for 12 weeks, but for 24 weeks. And, you know, that's okay, because unless you have a self-funded plan, you, the employer, you're not paying for it. Okay? The state's paying for it through the money that was paid into the program. So you're not worried about affording it, but it does mean you have an employee who is gone for 24 weeks. That's almost half a year. And if you have employees whose presence you can do just fine without for half the year, you may want to think about, are you hiring too many people? Don't think about whether you should fire that one, okay? Because we'll get to that in a minute. I say I was very impressed with the regulations, and I am. One area where I think the regulations may be overly ambitious is in terms of the application and the certification of a serious health condition. If you have any experience with the Federal Family Medical Leave Act, which requires a certification from a physician, you know what kind of certifications you get. It's written on a prescription pad, and it says, please excuse John for the next 9 weeks. And that's what you get as a certification. Or if you're really lucky, you get something that says, please excuse John. He's psychotic, but he'll get better. and he should be better in 8 to 12 weeks. And that's the entire scope of it. On the other hand, the application, which is going to be online and largely filled out by the employee under the FAMLI Leave Act, FAMLI Leave, the new law, requires a certification form from a licensed healthcare provider. And remember, licensed healthcare provider means someone like a doctor or a nurse or physician's assistant or an RPN or an LPN or something like that. Under the Family and Medical Leave Act, it means anybody who your health insurance pays. So under the federal law, you can get a certification from an acupuncturist, from a holistic faith healer, if your insurance pays for them. Here, it needs to be a licensed Maryland healthcare provider. Well, it doesn't have to be a Maryland license, but it has to be a licensed healthcare provider. But listen to what the certification has to have. The first date on which the individual took or intends to take leave, whether the leave is intended to be continuous or intermittent, the date on which the serious health condition commenced, all treatment dates, what the period of incapacity would be. And incapacity is defined as they're not going to be able to perform the functions of the covered position. The appropriate facts related to the serious health condition within the knowledge of the licensed health provider. Now, not only do you never get that under FMLA, you probably are prohibited by law from getting that under FMLA because it exceeds what's required and you get in trouble under the Americans with Disabilities Act. A statement that the covered individual is unable to perform the functions of the covered individual's position. So the doctor has to have a position description. If you don't have position descriptions in written form for all your positions, you should. And if the leave is intermittent, the expected frequency and duration of the intermittent leave. Now, let me say, this is all very good. This is all stuff the agency should have and should be entitled to. But if you've ever seen a federal FMLA certification, it is a fantasy to believe that a licensed healthcare provider is going to do this. Many licensed healthcare providers now charge money just for that one little, please excuse John from school today, he is psychotic, okay? Lord knows what this is going to generate from the healthcare providers, and I would be very concerned indeed. The other thing, well, there are a whole lot of things. It's almost impossible, in my view, for a healthcare provider or anyone to determine how the intermittent leave is going to be used. Intermittent leave, sometimes it's taken for periodic visits. Somebody has to go to the doctor once a week on Thursday afternoon for dialysis or therapy or physical therapy or something like that. That's easy to plan. That's easy for the certification to say. But much of the time under the Family and Medical Leave Act, we see certifications that say this employee gets terrible, debilitating migraines and needs to take time off whenever they occur. How do you plan on that? How do you give notice of that intermittent leave schedule? What the regulations say is that someone who's on that type of intermittent leave still has to be in compliance with your regular leave policy. That is, if they know it's coming on, they got to notify you. If they're home on a day that they were going to work, they have to call. Otherwise, it's no call, no show. But if they don't, and if the employee fails to comply with your regular policy, what do you do to them? Can you fire them? No. Can you discipline them? No. It will not be considered retaliation for an employer to request additional information. So you can ask them what's going on, but that's about it. I think that intermittent leave here is going to be as much of a problem as intermittent leave is proven under the Family and Medical Leave Act. I also should note here, and this segues into the next topic, what's the interrelationship between FMLA leave, family leave, and other leave? When an employee qualifies, or you think an employee could qualify for federal family medical leave, the employer has an obligation to act. If someone, says, look, I'm going through cancer treatment, I'm not going to be here for a while, you have an obligation to give them the forms, give them the notice, and to put them on FMLA leave. You're not allowed to wait a week or 2 or 3 and then put them on FMLA leave in order for them to have a greater period of protected leave. That doesn't work well with the idea that someone is on both family leave, the new Maryland statute, and FMLA leave on the same time, if the employee can wait 60 days after going on leave to apply. So you have to be careful. You can't just monitor applications. I mean, when somebody applies for unemployment compensation, you know about it pretty soon. And you respond. Usually you don't have to respond in 5 days at the risk of not being able to respond, but you know about it pretty soon. Here, someone can actually go out, expect to be paid these benefits, perhaps retroactively, and not apply for 60 days. So you need to be aware if someone is staying home for medical reason, because you may have, if you're covered by federal law, you may have an obligation to put them on family and medical leave under federal law, even if they haven't applied for the family leave under the new Maryland law. And that, as I say, segues into the next issue. Can you force the employee to take other leave? I've always thought this is, under federal law, a really unfair situation, and unfair in favor of the employer. I refer to it sometimes as cram down. If under federal law, if you're covered by the Family and Medical Leave Act, and one of your employees has 3 weeks of vacation time coming to them, you can say, congratulations, you're on federally protected Family and Medical Leave Act leave. The first 3 weeks, we're going to suck up your vacation, pay you, but suck away your vacation, and after that, it'll be unpaid, because we're going to make the 12-week federal period run concurrently with your vacation time, or sick leave, or quite frankly, any other time, PTO. Just most people just have general PTO these days. The answer is harder with the new Maryland law. If you look at the proposed regulations, it says straight out, neither the employee nor the employer may require the substitution of general purpose leave for family, FAMLI leave. Okay? But they can agree to do that. Moreover, as was discussed, you can use the time that they have in general purpose leave to top up their benefits. If somebody's making more than $50,000, $52,000 a year, somebody's a CEO and making, I've seen CEOs make anywhere from 35 to 3.5. But let's say the CEO is making $100,000 a year. You can use existing general purpose PTO to top up the salary, or you can convert the dollar amount of the supplement into the corresponding number of general purpose leave hours and give more leave. Now, if you do agree with an employee to use general purpose leave to supplement, the agreement has to be in writing. And if you don't have it, you can't make them use general purpose leave. If you get the writing, you got to keep it in your file. That's what the proposed regs say. What does the statute say? The statute, the law that we're talking about implementing here, says if a covered individual takes leave, which covered individuals receiving benefits under this title, the leave shall run concurrent with eligible leave that can be taken under the Family Medical Leave Act. Now, of course, an employee who's worked 1,280 hours in the preceding year is covered under the Maryland Act, isn't covered under the Federal Act. But if they're covered under both, that can be concurrent. The statute also says a covered individual shall exhaust all employer-provided leave that is not required to be provided by law before receiving benefits under this title. So safe and sick leave required to be provided by law, not subject to the exhaustion requirement. General excess, my read of this is not in the regulations, and this is in the statute I found online. I hope it's been amended, because it's been amended 4 times before it goes into effect. But if it hasn't, excess general employer PTO above and beyond safe and sick leave requirements can be, as I said about the FMLA, sucked away first. The difference is that if you suck away that general PTO, under federal law, that counts against the 12 weeks. Under the Maryland state law, it doesn't. So it gives you an additional 12-week period. The last thing I want to talk about, and I said I wouldn't speak for an hour, it's bad to get before. Last thing I want to talk about is the reinstatement requirements. Under the FMLA, the general rule is they're entitled to the same position back or an equivalent position. Under the new Maryland law, they're entitled to, doesn't say the same position, it says an equivalent position. That's pretty standard, okay? Now, Ms. Vaughn did talk about a limited hardship option where you don't have to reinstate someone, but it's very limited indeed. I mean, let me read what the law says. First of all, during a period of leave from work under the new Maryland law, you can terminate an employee only for cause. You know how we always talk about at-will employment? You can be fired for any reason or no reason at all. Why am I terminated? No reason. We don't need to have one. If someone's on leave that qualifies under the new Maryland law, they can only be terminated for cause. And I'll talk about the difference between that and the FLSA, the FMLA in a minute. But the limited hardship objection that Ms. Vaughn talked about says you can deny restoration of a covered individual to their equivalent position of employment if the denial is necessary to prevent grievous economic injury to the operation of the employer. You tell the employee as soon as you figure this out, and if the leave has already begun by the time you tell the employee, the covered individual elects not to return to work. In other words, the employee has to agree if they're already out on leave. So there is this limited hardship exception, but it is extremely limited, and you should rely on it in no case. Very last thing I want to say is what you can do when somebody's on leave and you got to fire them. I can't tell you the number of times, and probably about 40% of the Federal Family Medical Leave Act situations in which I get involved, where a manager has gone out. When somebody's on leave, you have somebody else doing their job, and you discover that the person on leave has screwed up royally. Okay? They weren't keeping files, they were doing this, they were doing that. When I was a baby lawyer, this is going back a long way, but this is before emails, before free international calls, even before anybody was really using faxes. We used teletype. Anyway, I was monitoring a particular situation at the federal government for a client in Australia who needed to know immediately when X happened. And I told my secretary about that, and X happened, and I got it the same afternoon, and I gave it to her to send in it overnight. Federal Express to Australia. And she took leave about 2 weeks later, and we found that letter in its Federal Express envelope in a file in her desk to be mailed. When people go on leave, things get found. Now, unless that results and is sufficiently severe as to result in a termination for cause, not defined in the statute, not defined in the regulations, you can't fire them. Under federal law, if you have a circumstance where the person on leave would have been fired had they been there, you can fire them. For example, if you find something terrible that they did, you can fire them. But that commonly comes up in the circumstance of someone being out on leave when there's a reduction in force or a reorganization and their position has been eliminated. Someone's out on Federal Family Medical Leave Act leave and their position has been eliminated, you can fire them. You certainly don't have to reinstate them. Or if they're involved in a RIF and they would have been selected for the RIF, reduction in force, and you can prove they were selected for the RIF, you can fire them. Not so under the new Maryland law. Okay? Unless it constitutes cause and being put in a RIF, elimination of the position, those are not terminations for cause. Unless they can be terminated for cause, they have to be given their job back. So somebody goes out on Maryland leave and you decide that you only have one branch and you really don't need 742 tellers, and you decide to lay off 740 of them, and the person who's out on leave is one of them. When they're finished with their leave, they're entitled to come back to an equivalent position. Different standards. I think that if you're old like me, I am old and fat, but be old and skinny. If you're old like me, you remember when the Family Medical Leave Act became effective in the early 1990s. And for the next 5 years, everybody was giving seminars about how it related to unemployment and workers' comp, short-term disability. I suspect that when this new Maryland law, which is a good law, I like it, when this new Maryland law comes into effect, we're going to be thinking, for 6 months or a year about how it interplays with FMLA if you're eligible for that, certainly with Maryland Safe and Sick Leave, certainly with general PTO. We're going to have to figure out our ways through that. But if I could leave you with one thought, and this is my concluding thought, don't think of this as a baby Family and Medical Leave Act, because it is fairly substantially different. John, Crystal, that's sort of all I have to say on that. I notice I was not wrestled to the ground by the folks from the Maryland Department of Labor, which I'd asked them to do if I said anything particularly stupid.
No, not at all. It's great help, John. I think, the one question that I have, and I know they don't have this definition out yet, but the idea of the privately insured options, along with the other option of doing a self-funded plan and having to be equal or better than what the state plan is something will be an interesting, how they work that with the Department of Insurance and the programs.
I agree. If you have a privately funded plan, first of all, I think unless you are an enormous credit union, it probably behooves you not to have a privately funded plan. I mean, if you have a privately funded, self-funded health insurance plan and you're big enough to support that, maybe you can consider it. But unless you're enormous, I don't think a private plan is the way to go. A privately funded plan is the way to go. But with respect to the insurance products, that may well be less expensive. And remember, this is not only an expense to the credit union, it's an expense to your employees. It's taking away 0.5% of their income, just, for a good purpose. Social Security takes 7.5%. But if you can get it cheaper from an insurer, maybe that's something to consider. What I would recommend even for plans that have been approved, is that someplace in the contract you have with the insurer, get them to say, if someone decides that what we're doing is illegal, we take the rap and the credit union doesn't. An indemnification clause.
Yeah. That issue of that where you can gift your employees their portion of the 0.49%, right? So that would be 0.0049 of their salary.
So, for both, so it's
yeah, so right at yeah, just close to 0.1%. So that would be something I think for folks to consider. But it seems until the final rule's done, and if the amendment that is before the legislature right now passes, but one of our folks on the call earlier had asked, when will this be effective? And if the plans are not approved yet, if I recall, and I ask you if you remember, one of the issues would be is if you're waiting to see about doing a privately insured portion versus paying into the state.
Right.
If you decide not to do that and you haven't started to pay into the plan, you have to pay in all the back amounts that were owed. So
plus
it would
plus
interest. So it would, if you're going down that road, it might be worth talking to your accountants about accruing for that funding.
Oh, absolutely.
While you're investigating that, just to protect the credit union.
Absolutely. That would have to show up in the balance sheet as an approved liability.
Yeah. So I don't know if there's any other questions that are out there from anybody.
As far as I can tell, there are none.
There are not.
It also appears that 42% of our people are sleeping.
So it says here, if an employer opted into a commercial plan to offset the FAMLI, would the benefit have to apply to all employees or just those who work in Maryland?
Just those who work in Maryland.
Right.
And just those who work in Maryland who work there for 680 hours a year.
Yeah. I think that's one of the clear, that seems to be one of the common themes of many of the questions is how do we deal with employees that work in Maryland, live elsewhere, or the fact that their credit union is located or domiciled outside of Maryland. So,
and the people who work at home, how do we keep track of that to make sure they're working 200 hours a year, not 700 hours a year? Yeah.
So, all right. Well, I just want to thank John, as always. Thank you for making the time to be with us today. Also, thanks again to the Department of Labor for being here. And I thought it was great to have them here and them on. If all of you that are attending today, please continue to communicate to us. That's how we brought this program to you today, is through your feedback. And I got to put a plug in for Crystal and the HR Roundtable for really wanting to have this session. We can do another one down the road once things are settled and as we move forward, but don't hesitate to reach out. Thank you all very much. Have a great rest of your day, and we'll talk to you all soon. Thank you.
Thanks for being with us, everybody.
Bye-bye.